What's up, everyone? Welcome to our weekly live. We missed everybody last week when it was a holiday, but we are back and this one's going to be great. We've had a lot of feedback and questions when we said that we were going to do this one today. So I have a ton of information to go through with you in a fairly short amount of time. So if you have any questions at all, just go ahead and post them below. I am going to try to keep an eye on the comments so that way I can address some of the things that you have questions about. And we did get some questions in already, so I will be addressing those as well. So what I want to do is just kind of start off. If you read my email, you heard a little bit about my story, but I didn't really share too much about it. But I just want to share about kind of where I'm coming from and, struggling with low back pain. And listen, I'm not a low back pain cure. That's not my objective. My goal is to optimize neurobiomechanical integrity, which when we do that, it allows your body to function at a much higher level. More often than not, your back pain goes away. But I understand how debilitating back pain can be, very intimately and very personally. When I was in my late 20s, I was in Singapore. I thought that I was invincible. I felt like, I could never hurt my back. I felt as strong as an ox and I could put myself through anything and I was going to be fine. And I'd never experienced low back pain before. And for those of you that know me, I'm an all or nothing person. I don't just deal with a little bit of pain. I'm either not in any pain at all or an excruciating pain. There is no middle ground for me. And so I was doing really heavy kettlebell swings on my rooftop. And on the downward swing, I was fatigued. I was tired. My body didn't feel right. I didn't listen to it. And on the downward swing, I felt a pop in my low back. And I knew that was not good. I also was not going to stop until I finished my workout. So I kept going, I pushed through it. And then by the end of it, things were just a bit stiff. I had no idea what was to come, and nor could I ever even prepare for it. Later that night, it got really bad. Middle of the night woke me up. By the next day, I could barely move. Rolling over in bed was excruciating. I couldn't even put on socks without grabbing my leg in excruciatingly pain, either bending forward or pulling my leg up just to put my socks on. And every step was excruciating. Every movement was excruciating. Even when I wasn't even just sitting, even in good posture, was excruciating. And I remember I had a very busy practice at the time. And in between patients, I would go back into my office and I had a rolling stool, like one of these stools that you are just like around on wheels. And I would basically kind of hold on to it as I lowered myself down, and I would drape myself over this stool just to try to create some gapping in my low back because it was just so painful. I had to use the table and the desk to lift myself up off of like when I was adjusting a patient to stand back up again. I couldn't work out. I mean, I thought I was going to have to I was a few years into practice. I thought that I was going to have to give up my career and literally just go into consulting or coaching, or I was even researching online at the time, other professions, because I'm like, I cannot go on like this. It was that bad. And I'm not, exaggerating in the least bit. I wish that I could describe the level of pain that I was experiencing. And this went on for months. And, going through at the time, I wasn't grateful for it. But looking back, I'm incredibly grateful because it led me on a journey to, number one, figure out how I can support myself and get better. But also, it allowed me to develop a much higher level of compassion and empathy for people that were coming in that were suffering, because I could put myself right back in that moment and intimately connect with what each one of my patients was connecting with. And it lit a fire under me and a passion to serve even greater and to connect even deeper. And so looking back, incredibly grateful. One of those grateful experiences that I never, ever, ever want to happen again, nor would I wish on even my worst enemy. And so let's go through some of the things that you can do that can help to transform that. So number one is, if you're taking notes, this is where you want to start taking notes. Number one, it's going to sound simple, but not often done, is stop hurting yourself. And there's an old adage that when you go to the doctor, it's like, all right, so what movements bother your shoulder? Oh, it bothers me when I lift my arm above my head. Okay, I have a cure for you then. Well, okay, what's the cure? Stop lifting your arm above your head. And there's there's certainly some truth to that. And here's where that comes from. You have this idea in neurology, which is what's known as central sensitization, where as your nerve system gets used to firing, it gets more and more sensitive to that same stimulus. And when it gets more and more sensitive to that stimulus, it fires at even easier levels, to the point to where you don't even need that stimulus. Sometimes even the thought of that stimulus causes it to fire and you'll feel the pain. So an example is like, let's say somebody punches you in the arm, and it's not very hard. They just punch you a bit. Okay, no problem. It's not painful. But if they do it 4 times, now it starts to become painful. And then each time it becomes more and more painful because that nerve is heightened and it's much closer to that level of threshold. That's an example of the idea of central sensitization. And the way that happens is through neuroplasticity. Your nerve system has the ability to grow new connections and strengthen already existing connections. And so when you do that in a positive way, you get great results. But when you do that in a negative way, you end up getting chronic pain syndromes that are very difficult to make go away. So the first thing that you want to do if you're suffering from low back pain is figure out what's causing the low back pain, or what's causing you to feel the low back pain, whatever movement that is, and stop doing that movement until you get an evaluation to find out exactly what's going on. Because if you keep doing that, you're priming that pump to experience more and more of that pain. Number 2 is you want to figure out where the root cause of this problem is coming from. So kind of the steps that I'm going to go through with you here, and then we'll unpack each one of those, is if something is out of place or out of alignment, you have to put it back into alignment. That's the first thing you have to do. Then once it's back in alignment, you have to regain stability and control of that new alignment. And then you need to regain the right movement patterns. Now that things are in the right position and you have stability, then you want to start to increase your range of motion. And then you want to get strong within those ranges of movement. So you have to follow those steps. So number 1, stop hurting what you're already hurt. Number 2, put things back into alignment that are out of alignment. Then the next one, number 3, create stability and control within that alignment. Then regain the right movement patterns under that new alignment and with that stability and control, and then get strong under those ranges of movement. And so if we're going to unpack each one of those, how do you put it back in place? Well, if you have a neurobiomechanical insult to your spine that's causing an abnormal shift to occur, that's irritating those nerves and causing a weakness and abnormal wear and tear, the first thing that we have to do is we have to make sure that we correct that alignment, get that back into place, get pressure off of the nerve, so that way the body can heal much better. It's kind of like if you have a poor alignment in your car and your tire is rotated, and now all you're doing is turning the wheel even harder to pull it back into alignment, you're going to get the car to go straight, but you're going to wear your wheels out in the process. The best thing to do is to correct the alignment and then start to, move in the right direction. So once you get everything put back into alignment, then we want to look at stability and control. And so there's multiple things that you want to do in order to create stability and control. The first thing that you want to do is you want to learn how to breathe. So that is, you have chest breathing, you have diaphragmatic breathing, you have 360-degree diaphragmatic breathing, and then you have the ability to actually change breathing through the chest, breathing through the stomach, breathing through the abdomen, breathing through the low back. You should be able to breathe through all these different positions. Once you're able to master your breathing without loading, then you want to learn number 2, which is how to brace. So how do you create stability within the midsection? You see a lot of people that are wearing these weight belts or these braces, and while those can certainly be beneficial, one of the greatest things that you can do is actually learn how to activate your own internal brace. Instead of relying on an external brace, you have an internal brace, and it's made up of the transverse abdominis, the obliques, the quadratus lumborum, the pelvic floor muscles, the diaphragm. All of that is like a cylinder that compresses outside in and top to bottom to create stability that wraps around your organs and wraps around your lower spine. And so how do you do that? Well, the simple way to do that is 2 things. Number 1, and make sure you're over a toilet if you're going to try this, unless you have good control, is what you do is you take a breath in and do that bear down like you're going to have a bowel movement. And again, don't do this unless you have good control or you're over a toilet. But really what you should be able to do is you're not going to go to the bathroom if you do that, because you're bracing your pelvic floor as well as the diaphragm, and then creating this internal pressure that's creating stability around the midsection. Next level. So we have breathing, bracing. Then you want to be able to BWB. What does that mean? Breathe while bracing. So you want to be able to create that brace and then breathe into that. Now, normally it's easy to breathe, do diaphragmatic or 360 breathing when you're not bracing, because everything will expand as the diaphragm goes down. But if you're bracing, you're not creating any room for all of your organs to expand externally. So you're creating compression, and the diaphragm needs to be a lot stronger to be able to do that. Plus you're creating resistance in your core, that cylinder. And so it's requiring you to work a little bit harder. The next thing, I know we're going through a ton, but if you're taking notes here, I'll double back and answer any questions if you guys have questions from this. The next one is you want to eliminate any extension and flexion faults. And what does that look like? That's if like you're like this and your ribs are flaring up. Let me stand up here. Your ribs are flaring up like that. That's what's known as an extension fault, where you're hyperextending the low back. A flexion fault is where you're flexing that low back and you're not creating any stability through there. So you really want to make sure that you eliminate any flexion and extension faults, especially when you're using any load. Once you do that, then you want to learn how to get better activation out of your glutes and your adductors. So your glute medius is a very big stabilizer for the pelvis and the low back. And one of the things that works antagonistically or opposite of that to create stability in the hips are the adductors. And so most people are just trying to fire up their glutes, but they forget to work the opposing muscles to that to create that stability on both sides. And then the last thing is you want to learn how to create rigidity in the system. Now, a lot of you might be thinking that, you know, why do I want to create rigidity? I thought it was better to have flexibility. Well, not necessarily. When you're lifting a load, when you have weakness or you don't have good neuromuscular control, you want to be able to activate and create a rigid system, because the more stable something is, the stronger it is. And the more flexible something is, generally speaking, the less stable something is. That's why joints that have greater ranges of motion tend to be less stable than joints that have lesser ranges of motion. And so there is a delicate balance between that stability as well as that flexibility. So once you've mastered all of those things, which should be, you know, a couple of hours, you should be able to do all that. Then the next thing is you want to regain the right movement ranges. So you want to stretch long enough and hard enough and consistent enough to access full ranges of movement. But once you access those ranges, you no longer need to stretch. You just need to continue to activate those ranges of movement through the lifting and the activities that you're doing. And then the last thing is you want to get strong. And so somebody asked me in an email if I could discuss kind of some of my favorite exercises if you're working on strengthening the low back and creating more stability down there. So I wanted to give you a list of these. All of these you can find on YouTube, but make sure that you have somebody working with you just to make sure that your form is correct on these. So especially if you're dealing with low back pain, in the beginning, we want to limit too much flexion and extension of the low back. And so I like doing things that create intra-abdominal and intra-core stability, as well as activate the glutes and the hips in dynamic ranges. So that way you get the best of both worlds. You're working on bracing the core while strengthening a lot of your stabilizers upstream and downstream without putting too much stress, for example, on the low back if there's an acute injury there. So one of my favorite exercises for this are going to be lunges. So lunges are phenomenal. They put very little stress on the low back, but are incredible because you have to brace your core when you do them. And you're activating your glutes, you're activating your adductors, you're working your hamstrings, your hips. Everything gets engaged without putting a lot of loading in the low back. Step-ups are another great one as well for the same reason. I like thrusters. Some people will debate that because they don't have a lot of carryover in real life. There's not a sport that you're really thrusting, but it's a great way to activate those glutes to get those firing again, so then you can use them more in more functional types of movements. Kickstand deadlifts are phenomenal. Love kickstand deadlifts. It's one of my favorite ones. It puts much less pressure on the low back, but does an incredible job of activating the glutes. Goblet squats are good because they keep you upright. But again, to keep yourself from pulling over and falling over, you have to really engage your core at a deep level. Side bends are awesome. Most people that have issues, unless you have like a straight lateral disc protrusion, most people do pretty well with lateral movements. It's the flexion extension ones. Those are the ones that cause a lot of issues. So moving in lateral movement there helps to engage and find those new positions. Jefferson curls, awesome. Palloff presses, you can do it with a band or you can do it with a cable. Just look that up on YouTube. And then side planks as well as rotational side planks. So that would be like being on your side, reaching up, then rotating down, reaching through and coming back up. Does a great job of engaging the core in different movements and positions. You don't just want to engage doing something like crunches where it's just front to back. You want to engage all the different corners and angles of everything from all these different directions, so you create stability in every movement. Because guess what? Life is not linear. So we talk about always wanting to keep perfect form. Knees should always track over the toes, and you should never do rotation in your low back, and everything should be bending at the hips. But guess what? That's not life, right? Like when your kid is running and you're trying to grab them before they smack into a wall, do you make sure that you brace, you squat perfectly, you make sure that you're not rotating at all and bending at the knees? No, you bend over however you can to reach them and catch them from crashing into the wall. When you're playing sports, if you're playing softball or kickball, or you're running around with your friends, or you're playing frisbee, or you're mountain biking, are you making sure that you always have perfect form and you're never turning or rotating? No. What are you doing? You're making sure you're doing whatever you need to do to get the job done. You're playing ultimate frisbee. You're going to be bending down, twisting, rotating. You're playing soccer on the weekend with your buddies or with your girlfriends. Are you really going to be just running in a straight line perfectly with knees over toes? No, you're going to be translating side to side. You're going to be pivoting and rotating, and knees going to be dropping in, and it's going to be going external. Same thing with your low back. And so we have to train it in really good, healthy beginner movements, but we want to be able to train and strengthen ourselves in all ranges of movement, so that way we decrease our risk of injury, increase stability, while still making sure that we get our spines and nerve systems checked and adjusted as necessary to maintain that neurobiomechanical integrity with a great structural chiropractor. And guess what? I know where to find one. So reach out to me and we'll get you set up or get you checked if you're not already under care. If you are, stay consistent, because it's all these pieces have to fit together. If you're losing one piece, it's like a house of cards that comes tumbling down. So thank you guys so much for tuning in. Post your comments or questions below if you have anything. Also, you know what? If you've learned something, just post that below too. I'd love to know what you've learned. And it's always a pleasure to plan these things for you guys and share with you guys. So have a great one. Get strong. Bulletproof your low back. Take care.